Now let's solve the challenging case 93, which is of retina or fundal disorder. Now here I am showing you the fundus of a 40 years old female patient, and you can see that there is a pathology on the fovea, on the macula, multiple tiny dots, yellowish in color all around the fovea and on the fovea in both eyes. Now if it is unilateral, as Hassan Nadeem correctly mentioned, that we can think of aggressive grid or focal macular laser performed by a new trainee, because these dots just look like laser photocoagulation spots. But thankfully it is bilateral, and vision is also good, because if laser was performed the vision would be extremely decreased. So it means these yellowish round lesions are due to some systemic pathology, most likely some retinal dystrophy. Now depth of the lesion is also very important. If you look closely, you will see retinal vessels going above the lesion, so it confirms that these deposits are deep, somewhere around the level of RPE. Now from this discussion it is now confirmed that these could be Drusens. Now what are Drusens? Drusens are extracellular deposits located at the interface between retinal pigment epithelium and Bruch's membrane. Drusens are formed from immune mediated and metabolic processes in RPE. When eye is unable to eliminate some waste products from cells of rods and cones, the damaged cells, also called lipofuscin, from oxidative stress accumulate in the Bruch's membrane and create drusen. So the lipofuscin or drusen is a cluster of protein and oxidized lipids that don't degrade. Drusens can be small, also called droplets when mere less than 63 microns, intermediate when between 63 microns to 125 microns, and large when over 125 microns. So these shown, they appear to be of intermediate size. Now these are mostly associated with age-related macular degeneration. In AMD you will find pigmentary abnormalities and drusen of all sizes with visual loss. In this patient, the finding was incidental with good vision and no pigmentary changes, so we ruled out AMD as well. Now the most probable diagnosis in this case is familial dominant drusen, also called Duane honeycomb retinal dystrophy, or Malacia leventis autosomal dominant radial drusen. Now it represents an early onset variant of AMD. Patients are asymptomatic with yellow-white elongated radially oriented drusen that develop in the second decade. They extend up to the disc margin. With age, the lesions become dense and acquire a honeycomb pattern. Vision can be affected in advanced stages due to RPE degeneration, geographic atrophy, or CNV formation. Another differential could be cuticular drusen or early adult onset drusen seen in young adults, small yellowish droplets that tend to cluster and increase in number with time and can progress to serous PED. FA shows stars in the sky appearance. Another differential could be type 2 membranoproliferative glomerulonephritis. Thank you very much.